Could everything you've ever been told about postpartum be wrong? I hate to break it to you, but most of the things that we hear about having a baby and getting your body back after baby are just incorrect. You might want a mommy makeover, and that sounds like a really great, sexy option, but the reality is if you don't heal your body after pregnancy, we are going to end up with a soliloquy of issues that plague us in our 40s, 50s, and 60s. So I'm here to break down exactly why you should think about healing your body after you have a baby and how it's absolutely okay that you don't feel normal or you haven't bounced back. Pregnancy is trauma. It's not just a journey. It took 40 weeks for you to grow that human, give or take a few. But the reality is when that happens, our uterus is expanding and growing, and our muscles on the front of our belly have to expand and grow. Our pelvic ligaments actually become more flexible and unstable so that the baby can leave our body. And so regardless of how you had this baby, whether it was an abdominal belly birth or whether it was a natural unmedicated vaginal delivery, it doesn't matter. Your body was affected. Your pelvic floor was affected. Your core was affected from the front of your belly to your pelvic floor, to your glutes, to your diaphragm. It all is affected. And so you need to know how to get your body back to feeling like you have control of your core. And that's what we're going to go over. Usually doctors will use a 6 to 8 week postpartum checkup in order to determine if you are cleared to get back to exercise or get back to sex. And let's be real, they're usually not even checking the pelvic floor and doing an intravaginal exam when they are checking you. And if they are, they don't really know what they're looking at. They're like, okay, everything's healing. You're not open. You're not bleeding. Perfect. We're good to go. And yep, now go do your exercises or go start having sex again and everything will just go back to normal. No, that couldn't be further from the truth, okay? After you have a baby, your uterus has to come back together. So you continue to slough the lining, which is called locatia. That starts to leave the uterus. And so once that stops, that's usually when you get clearance to go back to exercise. But what is most gold standard and absolutely needs to be the case is to have a thorough exam of your pelvic floor and of your deep core muscles, everything that's changed during your pregnancy. This should be done with a pelvic expert physical therapist, someone who knows exactly what your body has gone through and what to look at. They should be looking at how your knees and your hips are moving. They should be looking at your low back, your pelvis, your pelvic floor, internally, externally, the muscles on your core, and then they can determine where your organs are lying. They can say, oh, maybe your bladder's come down a little bit, or maybe you have a diastasis recti, which is a split of the abdominal wall. They will be the people that have the most expert opinion on, okay, here's what's going on, here's what your postpartum picture looks like, and then here's what we need to do in order to get you better. During your pregnancy, estrogen and progesterone skyrocket. They are through the roof. This is part of what creates that ligamentous laxity and that flexibility in the joints that I was briefly just discussing. Well, what also happens is after you have a baby, those hormones plummet. And what happens is that we have prolactin, which then is spiking our ability to breastfeed and create milk. And we have estrogen continuing to be inhibited and depressed in our body as we are lactating. A lot of times estrogen doesn't come back to normal levels until 6 months. And a lot of people don't even feel like their levels come back to normal until about 18 months. This isn't routinely checked in postpartum women, although it should be, but low estrogen and progesterone can create low sex drive, lack of lubrication, and then when we don't have our estrogen working for us, we often have difficulty building more skeletal muscle mass, which can make it even more challenging to get back into the gym and to start to see results. So that's why it's very important to know where your body's at and then to truly heal the foundation of your deepest core muscles, your pelvic floor, your deep abdominals, your glutes, your lower traps, and your lats. All of these are essential at creating that core container to make sure that you are ready to hit the gym running and not set yourself up for any aches and pains or injury. When we're told to just start exercising, get back to the gym, that's when we really start to set ourselves up for things like pelvic organ prolapse or diastasis recti or even hemorrhoids. It can also lead us to lifelong pain that can create knee pain or ankle pain or hip pain or plantar fascia pain. And the reason is we create new patterns after we have a baby. If our core isn't working and hasn't come back together and we just jump back into the gym, what happens is our body compensates absolutely beautifully. The pelvic floor will start to compensate, and the compensations that we see most frequent are that we lack hip extension, so the glutes never really get to turn back on, and then we overuse our pelvic floor because the deep transverse abdominis muscle hasn't turned back on yet. And so the pelvic floor then gets really tight. And if you had any scar tissue during your delivery, then that can lead to a world of not having core function, and the pelvic floor gets even tighter around that scar tissue, and therefore it can't fully relax, it can't fully contract, and it absolutely can't overstretch. So it's going to negatively impact how it helps be like a core contributor to your core function. What the pelvic floor needs to do is it has to be able to really open dynamically and stretch pretty well in order for every time that your foot hits the ground or you do something that absorbs the shock, the pelvic floor should be absorbing the shock. There should be this nice dynamic movement of the pelvic floor as the bottom of your core muscle. So most people don't actually show symptoms of having incontinence or even diastasis recti right away. They usually don't show symptoms until like 8 to 18 months, and then maybe their bodies continue to compensate beautifully and they don't have problems until they're like 45 or 50. And if you trace that back, what happened is that they could have not ever had these compensations in the first place if someone would have just helped them rebuild their core. So that's why it's amazing that you're getting this information today and that you are going all in on starting to heal your body before you jump back into the gym. A lot of European countries actually get pelvic floor physical therapy for free after they deliver a baby, which is absolutely amazing support because then they end up having high functioning cores, so lower risk of joint replacements, lower risk of issues as the women age in that country. So pelvic floor PT is absolutely preventative for joint protection, protecting you from low back pain, hip pain, protecting you from years of chasing pain, from getting cortisone injections to getting joint replacements. We want to prevent that, so get your core in check, really do a dose of pelvic floor PT. Everyone always says it doesn't matter what it costs in the end, right? Like when you're in your 50s and 60s, you will give away your whole net worth just to feel good again in your body and to help prevent those surgeries. But when we're postpartum and we're learning how to pay for daycare and we're figuring out all the how do we make this work with kids and we have humans to keep alive and it's all so expensive, we put ourselves in the back seat. We don't take care of ourselves. There is no better gift you can give your future self than keeping your core, getting your core back, healing your body truly, limiting the compensations, and then staying super strong so you protect your joints, you protect your bladder, you protect your organs from staying inside your body. This is buying your future self time, it's buying your future self money, because in the end, you will end up paying so much more when you're chasing all this pain and not getting to the root cause. So that's why I truly believe people that heal their bodies postpartum, they are doing their future selves absolute justice and truly taking care of preventing issues in the future. So they're not the little old ladies in the nursing home wearing diapers in their dying from pressure wounds, because that's the reality of what is happening in America, right? We are getting shipped to the nursing homes wearing diapers, and those, because we're not moving much, we're sitting in our chairs and or laying in our beds, leading to skin breakdown, leading to pressure wounds, which can create infection, and that is how a lot of people pass away. And we want to prevent that by staying mobile, keeping our core strong, staying continent, because by the time we're old and decrepit, no one really cares that they're leaking at that point, right? Usually our problem lists are so much longer. Our hearts aren't working. This isn't working. That's not working. And that takes the forefront, right? So get your core in check, get your pelvic floor in check, and that will do you a world of amazingness. I'm Dr. Allison Feldt. Thank you so much for being here. Please like and subscribe to this video and share to all your friends who have recently had babies.